So, questions?
Yeah, so I had one question for young teens who at this point are having a challenging time putting tampons in, and maybe the parent is concerned about future pelvic pain, gynecological visits, or other problems. What suggestions do either representers have for what to do to support a teen through this in addition to maybe pelvic physical therapy?
Go for it, Ariel, and I'll add a few sexuality education pieces.
Definitely. So, yes, I love that question because this vaginismus can really impact anybody at any age, any stage of life. The biggest thing here, I'm not sure the age of the teen, but just making sure we're checking with what her concerns are. Because, for example, if the parent, we're aware of potential gynecological exams and painful vaginal intercourse in the future, but if their main issue right now is like they want to go to the pool or just be able to use a tampon, then really just focusing on that right now and not adding any potential other things down the road. And then just acknowledging that at that age when you're a teenager, your body is changing so much, and just making sure you have open lines of communication and just really empowering your young teenager and knowing that like inserting a tampon, that should not hurt. It also shouldn't, if you're able to insert it, it shouldn't feel like it's just falling out. That's also a sign of that pelvic floor tension. It's just so tight, it's kind of pushing it out. So just making sure if they're trying to use that, they know how it should feel. It shouldn't be painful. And then just making sure you're attending to your child's needs as well. So if you are at a stage where having a gynecological exam is on the table, then making sure that you as a parent feel empowered to support your teenager and that they also start to feel empowered as well with asking for accommodations, such as using a pediatric speculum, for example, and also holding your providers, your physicians accountable as well, not letting them just dismiss your concerns. One thing I personally noticed at my OB's office, this was years ago, was on an intake form. I remember, now that I'm a PT, I remember reading dyspareunia, for example, but it's like, I didn't know what that was. I'm sure most people wouldn't know what that was. It's painful penetration. So then if you don't know what that is, you're not going to mark it off on your intake, and your provider isn't probably going to ask you about that. And then just depending on your personality and how you feel empowered speaking about your body, you might not feel comfortable or even know, like, this is an issue I can bring up. So just making sure that when you're with your provider, you are feeling comfortable with bringing up all of these symptoms, asking questions, and not letting them dismiss you and telling you, like we said earlier, just like drink a bottle of wine or it's all in your head. So
Yeah. I would only add to that there are some great resources for sexuality education, and that's another way that the parent can support that young teen going through the process of learning about her body and learning about sexuality. Roby Harris's books, they're kind of older now, but they're still fantastic. It's perfectly normal. It's so amazing. They're cartoon books that are really inclusive and really amazingly comprehensive in terms of sexuality education. Corey Silverberg's books, Sex is a Funny Word, You Know Sex. Those are good examples too. A local colleague, Lisa Watts, has a podcast called Ask Mrs. Watts, and it's specifically for parents to help them talk to their children about sexuality and sexual health. And there's a number of other resources like that. So I would just add that piece.
perfect.
Looks like we have a question in the chat too.
One more question we have is for pelvic floor physical therapy. If the client does not consent to an internal exam, what does that diagnosis and treatment look like? Can you talk us through that?
Yeah, so that happens. That is something we're prepared for. I like to explain that, yes, if I'm able to assess the pelvic floor, it does give me some really helpful knowledge. But at the same time, there are so many things that I can provide and also educate you on, keeping everything externally. So, kind of going back to what I was mentioning in the assessment, I would be looking at other areas of your body where you might have some like back range of motion limitations, just tension in the hips, or even the other way, maybe hypermobility, all of those things that can contribute to us compensating at the pelvic floor and holding tension there. There's also a lot of manual therapy techniques I would do to both help to kind of calm the body down, just trying to bring blood flow to the tissue, and just working on relaxing everything externally, going back to making sure you're not sucking in your belly. I do a lot of work on the abdomen. We hold a lot of tension there, unfortunately, even around the neck and the jaw. All of those things also are deeply connected into the nervous system. And I find that if you can just start to feel safe and just tolerating these external techniques, then your nervous system can start to calm down. And that's the optimal starting point that we're going to begin all the other things, such as your stretches or certain other maybe underlying things that could be contributing to pelvic floor tension, such as maybe the need to work on some stability. And then I would kind of touch back on their comfort level with looking at the pelvic floor. And it might even just begin with over clothes, me just over clothing over that vulvar region, over the perineum, having them try to coordinate those pelvic floor muscles moving. So there's a lot of other things I can do that really will help influence a positive change and just relaxing the muscles and helping the body feel nice and safe before ever doing an internal assessment. And oftentimes, a lot of those things make a really positive impact.
And we can help as therapists support somebody getting ready for that process too, working through some of the fears and the graduated exposure that you all are doing that you just described. We can be that safe space to process through some of the feelings and fears about it. So that I have over the years worked with folks in like a readiness way to get ready to approach treatment.
Yeah. So we are at the top of the hour. So please don't hesitate to reach out if you have other questions. If you're just kind of processing everything from the talk and just thoughts come up, feel free to reach out to us and we'll do our best to answer them.
Thank
Yeah,
you.
thank you so much.